Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
If you needed one more push to get going on your fitness goals in the new year, 2 recent studies just might do the trick. Researchers at Harvard University and the Karolinska Institute in Sweden found that exercise is even healthier than previously believed.
Yeah, even light activity like vacuuming or walking the dog was helped to found to help reduce mortality.
Here to discuss is Dr. Francisco Lopez-Jimenez, who is Division Chair of Preventive Cardiology at the Mayo Clinic and also Research Director of the Dan Abraham Healthy Living Center.
Welcome back to the program, Dr. Lopez-Jimenez.
Thank you. Thank you for the invitation.
So let's talk about exercise studies and what can go right and what can go wrong between those. First of all, you're asking people to exercise and then turn in their results. Is everybody honest? I'm sure I would be, and I know Dr. Kakar would be for sure, but is everybody honest when you do this type of study?
Well, the short answer is no. We tend to overestimate the amount of physical activity and exercise we perform. We tend to be more optimistic about what we do, and therefore the validity of the research that we have, most of it regarding exercise and health benefits, relies on surveys, and there was this question about how reliable is what we know about exercise and the potential benefit, because everything comes pretty much from surveys. So that was before these studies and a few others, but I think it's fair to say that the majority of the evidence comes from surveys.
So Dr. Lopez-Jimenez, I know you weren't part of these studies, but can you explain to our listeners what they showed and the issues with them?
Sure. Well, these 2 studies were different than the traditional studies testing the same question about how good physical activity is for our bodies. Were different because they measure physical activity with some little devices, actually more sophisticated than the devices that people use these days to measure steps. Those devices measure every single movement the body will have, and they can separate intense activity, moderate activity, and light activity. And they can also identify those who are just not moving at all. Mm-hmm. And that makes those studies very unique, very powerful in terms of scientific value. And what those studies show was that when people perform light activities, they get a lot of benefit. It also confirms what we suspected for many years, that intense or moderate to vigorous activity is actually very good and perhaps actually better than light activity. And that's important to confirm. But I think one of the most relevant findings of those studies was that it doesn't really take a lot of exercise to get the benefit of it. And also that when people go from being completely sedentary to just moving a little bit through the day, that's actually the biggest gain, the biggest bang for the buck. Yeah.
We're supposed to, the message that I've gotten anyways, that I'm supposed to be moving 150 minutes, and I won't over-report. I woefully fall short of that quite often. But even any small amount, or should I still be aspiring to that 150-minute goal?
Well, that's an excellent point, because I think we have been making this recommendation all wrong. Mm-hmm. And the reason is because it is true that 150 minutes a week is going to be great. But by recommending to do at least 150 minutes, we are setting people for failure, many people for failure, because it's very difficult to make a person who is doing just a few minutes a week to go 150. And therefore, because nobody wants to be a loser, we would rather just not do anything than failing to this 150-minute goal.
Get out of my head. That's exactly the point. Exactly.
Right? So I think the main measures of those studies and what we try to tell patients is, if you are not doing anything, just move a little bit. Set a modest goal, because that by itself is going to be better than nothing. Now, once you do that, move to the next level.
Right.
And people might reach their limit with 120 minutes. Well, that's okay. That's actually pretty good and much better than nothing.
Well, I'm glad you mentioned that. It's funny, I bought my father one of those devices over Christmas, and when he hits 10,000 steps, it starts hitting goal, and he's very happy. But if he doesn't hit 10,000, he's depressed. So clearly the point taken is do something as opposed to hitting a number.
Yeah.
Let's talk about sitting, what we're all doing right now. And a lot of people who work at a desk are sitting for 8 or 9 hours a day. What does that do to our bodies?
Well, sitting too long it has shown to be very bad. And those studies actually also prove that, because they tested time when the person was doing nothing. And the assumption is that when there is no motion, it's usually because you are sitting. Sitting puts the body in a completely or total rest. And it seems like our muscles are not meant to be like that for long periods of time. And therefore, some activity, even minor activity through the hour, which means that, to stand up for a few minutes and then go back to your seat, actually improves the metabolism of sugar. And is something that is actually very impressive, because we will think that you need to be exercising for 10 minutes or just run or go upstairs 3-4 times to get the benefit. But again, very mild activities, breaking your sitting time, it's very good.
So I've seen more of my partners now having the desks where you stand as opposed to sitting. So clearly you would support that.
Yeah. The other benefit, standing actually burns more calories than sitting. Not a lot, but few that if you add them up at the end of the year, you might be talking about, a couple of, 4 or 5 pounds.
Wow.
That's one thing. Then the second thing is when you are standing, you are naturally more mobile. Mm-hmm. It is a more natural reaction to just go there. When I'm sitting, honestly, I might be just, even the trash, I will be throwing the trash because it's this sense of relaxation that you are just not moving.
Well, there you heard it, Tracy. We should be standing up and doing these interviews.
Well, I'm thinking that I did get up and walk across the studio, but I went to get a cookie that you had brought in, so I'm negating my effects there. So tell us about the research that is being done and when it comes to exercise and activity.
Well, there is a lot of research going on, and there are several questions, for example, that we still don't have a good answer for. For example, what is the limit at which it is just too much exercise? Mm-hmm. And this is very important because these days, in response to the recommendation to exercise, it is becoming more and more popular to start training for the marathon and the triathlon. And I think this has become kind of a thing for the people in my age, the late 40s, 50s. Everybody wants to run a marathon, a triathlon, and Ironman and other things. And the question is there a point where there is just too much exercise? And some research actually suggests that. And that's important because we might be able to be over-exercising. But it's important to make it clear that that's not a problem we face with most of the people.
Is that your problem?
No, that's good. No. I've got medical advice not to do that now. Thank you very much.
Say, I don't know that I'll ever bump up against that one. But all right, we've been talking about the benefits of activity, even light activity, with Mayo Clinic Division Chair of Preventive Cardiology, Dr. Francisco Lopez-Jimenez. Thanks for joining us, Dr. Lopez-Jimenez.
Thank you. Thank you for the invitation.